this week we're revisiting the topic of student support and mentorship. We did look at this last semester, and I gave you some reading from the Understanding Medical Education textbook for that. So if you want to go back and look at that, feel free. But what I'd like you to really focus it on this semester is about supporting our students through the assessment process. Last time we sort of looked at it more generically throughout the whole semester, but now thinking about how assessment impacts on a student and how we can help them do that. So you can think about this in a couple of ways. There's the traditional sense of assessment that, whether that be mid-semester or end semester, whenever the exam time is, I'm thinking about what kind of support a student might need at that stage. But then there's also thinking about the continuous longitudinal assessment that goes on in most clinical courses that requires the students to continually be building up this portfolio of experience, of satisfactory experience, and thinking about the times throughout the year when that might put a little bit more pressure on them. Maybe it's when they first go out on placements. Maybe it's when they return from those placements and need to sort of submit this portfolio. Perhaps it's moving towards the times when they might be sitting their clinical exams, maybe a fitness to sit process or something like that. So with clinical education, that support for assessment is often more than just once or twice throughout the year when the assessments happen. So with the resources that I'm giving you this week, think about how the assessment that you're designing at the moment for this module, but also for your general teaching practice, thinking about how that assessment might impact on the students and what, if any, specific support they might need. Considering the wide variety of students, the diversity that we're experiencing within our universities, is there anything about your assessment that might call for unnecessary support? Or is there anything that a particular group or subset of students might find challenging that might need a little bit of extra support? I've also given you a link to the resources from this specific university, UHI, about the personal academic tutors. Different institutions will call that different things. Sometimes it might be a student mentor. There's various different things, but I would encourage you to have a look at the guidelines for your own particular institutions that relate to this personal support that goes beyond simply supporting students like in their clinical environment. It's about pastoral and holistic care as well. So I would take some time to look at that from your own universities.